So for example, the dorsal body cavity is vertebral and spinal, vertebral and cranial, right? For the spinal column and for the brain. So you got to make sure you know that all your cavities. Make sure you know the cavity for the ventral body cavity and the dorsal. What encases each one of those cavities? You should know the planes, sagittal plane. You should know the different types of planes. Coronal, also known as frontal, transverse, right? Know all your planes, okay? Based on like the cuts, okay? So for example, you're gonna, on the midterm, you might see like, it might show you an organ in the body, and it'll show you the cut, and it'll ask you what kind of plane is that cut in, for example. So know your planes. Sagittal, transverse, coronal. Make sure you guys know your 9 abdominal pelvic regions, right? Like umbilical, epigastric, right and left hypoglossal. Know your 9 abdominal pelvic regions, because it'll ask you which one is lateral, which one is superior, which one like to what. So make sure you know you know those. You should also know all your anatomical and directional terms, like the difference between like anterior, posterior, dorsal, right? Proximal, distal, medial, lateral. Make sure you know those, because that's all fair game. There's a couple of questions on that for you guys, and that includes also knowing the anatomical terminology, like sternal, like brachial, like cubital. You should know what that is. You know, like carpal, right? You got a couple of questions on that, so we know them by their like regional terms. There's a few questions on that. Know the difference between like the visceral and the parietal, like with the membranes, right? You know, we have the synovial membrane, the visceral, the parietal. Make sure you know those membranes. That's important. So if you remember, I don't know if I showed you an example, like for example, if I'm holding the heart has a visceral covering and it has a parietal, right? You should know that. That's important. Okay. Know your stages of mitosis. That's very important too. Prophase, metaphase, anaphase, and telophase. And then you should know what happens in each one of those phases. For example, you did it in lab, and I'm sure you did it in lecture. So in lab, you were able to look at like the onion root tip slide, and you were able to see what like the metaphase plate, the chromosomes line up in the middle. For example, during anaphase, they separate to opposite poles. You should focus on that. Make sure you know the different phases. So you'll have like pictures of that. It'll show you, the chromosomes, for example, if they're lined up, if they're separating to opposite poles, it will ask you, okay, what phase of mitosis is this in? If it's in the middle, what phase of mitosis is in? You should know prophase, metaphase, anaphase, and telophase, right? So there's a couple of questions on that. So you should know what cytokinesis is when you think of mitosis, right? So cytokinesis, for example, when the cell gets ready to split up and make 2, for example, right? So you should know what that means. That's a part of mitosis. Now, you should know the parts of the microscope, right? There's a question or two. It's pointing to to a microscope part. You should know the parts of the microscope. That's important, okay? Is my microscope, is it pointing to the stage? Is it pointing to the objectives? Is it pointing to the fine adjustment, just the basic ones that I had you guys learn in lab, right? There's a couple of questions on that. There's a good 2 questions on that. That's very important. Take a look at a cell, like a colored picture of a cell, and look at your organelles, right? What they look like. Okay, there's the nucleus, the most prominent feature of the cell. Look at like what the mitochondria looks like. Look at what the rough ER. There is an image. You might see a couple of questions on some of the different parts of the cell, the organelles, right? Like what they look like. Okay, so that's important to kind of keep that in mind. Now, know some of the basics of the plasma membrane. Like how it forms the outermost layer. It separates the inside from the outside. It's made up of a phospholipid bilayer, which is a bilayer of what? Fat, cholesterol, phospholipids, things like that. Make sure you know that. When we think of fat on that bilayer, we know it's the phospholipid, because we refer to it as what? The phospholipid bilayer. So make sure you know that. The bulk of the plasma membrane is made up of that. Just the basics of knowing the difference between a solute and a solvent, right? Like if you take a glass of water, that's the solute. I'm sorry, you take a glass of water, that's the solvent, right? If you take salt, right, that would be the solute. Just know the basic of that. If you see a question that's showing you, you know, just know the difference between a solute and a solvent. Very simple. Okay, no, like you guys, you learned osmosis, right? You learned a little bit about osmosis. You learned a little bit about hypertonic, hypotonic, and isotonic solutions. Like, what happens when you guys remember? There's an image in your lecture, I'm sure, of a red blood cell, and I'll show you the red blood cell. What happens when it swells up? What happens when it shrinks? What happens when it's the same shape? You should know the difference between isotonic, hypertonic, and hypotonic solution when looking at like a red blood cell, right? So that's important too. No, so for example, your epithelial tissues, right? Basic stuff like simple squamous, stratified squamous, pseudostratified. Like, know what that means. Remember, the way we name those tissues, right? Based on the arrangement of the cell, like the layers and the shape, right? So like if you get images of that, make sure you know what that is. That's important. There's a good amount of questions, like maybe 3 or 4 of the tissues, right? So that's important to keep that in mind. Okay. Same thing with connective tissue, right? Like you should know, like adipose, for example. You should know like areolar, the dense regular, dense irregular. Know your basics of the connective tissue. You guys, you looked at slides here in the lab, you were able to see some of those. Just kind of open up your book, your lab manual, and just kind of like skim through, going back to looking at what they look like, some of these tissues, with connective and with epithelial, okay? Just kind of skim through it and see, you know, go back and kind of look at it, right? And that includes knowing cartilage and stuff like that too. So connective tissue, it's not just knowing dense regular, dense irregular, areolar, and that. Know your cartilage too, like fibrocartilage, elastic cartilage, hyaline cartilage, and what that looks like. Okay, that's important. Okay, there's a good amount of you guys. There's a lot of questions. I don't know. I'm looking at these, and there's a good amount of questions, right? So make sure you guys focus on the tissues. Just kind of skim through them, looking at the images. You know, just went through a whole bunch of them. Look at a skin model too, right? So like in your lab manual, there's a skin model, right? Make sure you kind of look at the skin model. Make sure you know the different things that you see in that skin model. For example, you'll be able to see like the erector pili muscle. You'll be able to see like, for example, some of the sweat glands, you know, like the eccrine, the apocrine, like some of the receptors, what they look like for pain, for touch, for pressure. Just look at that skin model, an image of it, and kind of look at what you see in the dermis, the epidermis, the hypodermis, just basic stuff in those images. There is a couple of questions on where you guys will be able to look at a skin model, at least know what you're looking at, right? Am I looking at a hair follicle? Am I looking at a sweat gland? Am I looking at a, you know, sebaceous gland? Things like that. When you look at that skin model, look at the different parts of a hair, right? Where's the hair root? Where's the follicle? Where's the... And then we said, make sure you guys look at the receptors. What are they, right? When you look at a skin model, is this a receptor for pain? Is it for touch? Is it for pressure, right? So I would take one of those skin models and kind of look at it, and on the image, that's all you need, right? we said tissues, bone tissues, okay. Okay, so like, make sure you look at the basic bone tissue anatomy. So you take a bone, there's the epiphysis, right? The ends of the bone, there's the diaphysis. What do you see in those areas, right? So like if you take the shaft of the bone, for example, diaphysis, what's in there? The medullary cavity, yellow marrow, right? The epiphysis, the ends of bones, what do you see there? That's the site where you see like bone, blood cell production. I'm at the site where red blood cells are made. You see the growth plate. Make sure you just basically look at the bone tissue anatomy, and you know, you see the difference between like the diaphysis and the epiphysis and what you see in those areas, okay? That's there as well. Same thing, bone, well, look, a good amount of questions too, like 3 or 4 I just saw. Bone tissue, right? When you look at, you guys ever seen like a cross section of a bone tissue? It looks like a tree bark or something. Mm-hmm. Make sure you know what that is, right? Like bones, the basic unit of bone is called an osteon, right? So make sure you know the parts of the osteon. I don't know if you remember this from your anatomy class, from your lecture class, like canaliculi, trabeculae, right? Lamellae. What is that? Like, what does that all mean when you look at a bone tissue, right? So that there is a question on that. So make sure you know the basic unit of a bone. That's important too, right? So again, there's what is the first cervical vertebrae called, you guys? Atlas. Atlas. The second one is called the axis, right? Remember, the atlas, the first one does not have a body, right? There is no body. You know how I showed you the body of a vertebrae? The atlas C1 does not have one. The axis has like a little dens, and it kind of attaches to the axis like this, and it allows you to rotate your head like this, you see? Right? So that's important to like be able to know, at least know what the atlas and the axis looks like, right? You know, I would look at that. And then again, there's a lot of questions, there's a good amount of questions on the bones. You guys covered them in class. Like, it's gonna point to a certain bone, right? It might point to your upper jaw, that's called the maxilla. It might point to your cheekbone, right? There's a picture, so it's gonna point to the bones that, at minimum, you see that I have on the list. You know, frontal, parietal, temporal. There's a good amount of questions on that, okay? So I asked you guys to look at the ones I have on the list. I'm looking at the questions on the test for next week. They're all, you know, they're from the list. So make sure you at least, you know, can identify them like by looking at a picture. That's important, okay?
Do we have to type, or is it gonna be ABC?
No, A, B, C, D. I'm gonna project the multiple choice there, and you guys get a minute for each question. And then we go through the entire question by question, one time deal. I'm not going back, so you guys got a minute to answer each question. If everyone's done before the minute, that's great. I'll go to the next question, right? If one person's not done, we got a minute. So again, make sure you guys know the basic. Did you guys cover joints in your class or not yet? Like in lecture?
Yeah.
Okay, some of you did, some of you didn't. Just know a little bit of the basics of like the joints, right? Like, what kind of joint are you looking at? Is it a ball and socket joint? Is it a hinge joint? There's maybe 1 or 2 questions on the joints. I showed you guys this. I showed you guys the sutures of the skull on a skeleton, right? Sagittal, coronal. What did we say those are? Those are immovable joints. They're joints that don't move, right? But they're also classified as fibrous joints that don't move. So make sure you know those sutures, like, you know, like sagittal, coronal, lambdoidal, things like that. Let's see, look at, you guys, look at maybe an image of the tibia, right? On your own, take a look at an image of the tibia, and you know, yes, you know that it's the you guys know it's the shin bone, right? You know it's the medial bone of the leg, right? But look at like some of the parts of the tibia, right? Take an image of the tibia, just kind of make sure you know like what you're looking at when you see a tibia. And then again, this you guys already know, I'm gonna say it. I would do the same thing for the humerus, right? Look at your funny bone. Take a look at your funny bone and kind of know like the basic parts of that. So when I'm telling you like the tibia and now I said the humerus, just one or two things you're looking at, right? So just kind of open up your book or a PowerPoint and look at it and see, you know, like the head of the, you know, like for example with the femur. The head of the femur, you already know the greater trochanter, the lesser trochanter, right? Look at the humerus and just look at the basic, you know, basic parts of that. And then, you know, okay, good, that's it. You guys done? I went through the entire thing with you guys. So look,